Hello everyone, myself Dr. Rakesh Godara, working as Senior Consultant in Department of Pulmonary and Critical Care Medicine, Interventional Pulmonology at CK Birla Hospital RBH, Jaipur, Rajasthan. If we see there is a big change the respiratory medicine has witnessed in the last decade is the introduction of EBUS, that is the Endobronchial Ultrasound. This is a special kind of the flexible bronchoscope with the ultrasound probe at the tip of the scope, and this opens the whole new world of diagnostic possibility endoscopically, which were earlier not possible at all. So we will try to understand that what is the EBUS bronchoscope. This is one of the latest tool addition in the field of interventional pulmonology. EBUS is mainly a diagnostic modality. It helps to take samples from the lymph node and the mass lesions which are not accessible with the conventional bronchoscope. There are two types of the EBUS bronchoscope. One is the convex probe EBUS bronchoscope that is used to take the samples from the mediastinal lymph nodes and the parahilar lesions, whereas the radial probe EBUS is used to take the samples from the peripheral pulmonary nodules or the lesions. What kind of the pulmonary pathology we can diagnose with the EBUS bronchoscope? As we know that tuberculosis is one of the most common infective disease that affect the lungs in our country. So the tuberculosis and other infective lesions, fungal infections, sarcoidosis, lymphoma, lung malignancies and the metastasis from other malignancies can be presented with mediastinal lymphadenopathy. As we encounter in our day-to-day practices that history, physical examination along with the basic lab that include the chest x-ray and sometimes an advanced CT scan that also will not provide definitive diagnosis in majority of the cases. In these situations, tissue sampling from these abnormal lymph node become necessary to make a definitive diagnosis. In these situations, EBUS bronchoscope is very helpful to take samples from these abnormally enlarged lymph node or the mass lesion. How the EBUS is useful in the malignancy? EBUS bronchoscopy is very useful in making diagnosis and also staging of the lung cancer effectively. In follow-up cases of malignancies, EBUS is useful in taking sample from PET-CT abnormal lymph nodes. Even enough tissues can be taken for further molecular analysis, and in this way it can avoid the need of surgical mediastinoscopy in most of the cases. How do we do EBUS bronchoscopy? EBUS bronchoscopy is done at the bronchoscopy suite. It can be done in the conscious sedation or the under general anesthesia that depend upon the patient's profile and the comorbidity and need for the procedure. Patient has to be fast overnight for the next day morning procedure. Generally, doctor go through a checklist before a procedure. A CT chest or the PET scan is a prerequisite before the procedure. The contrast CT is more preferable. CT chest helps to note down the abnormal lymph nodes, their size, location, character and any abnormal lesion before starting the procedure. In this procedure, EBUS scope are inserted into the tracheobronchial tree. Then with ultrasound probe, we can see and measure the lymph nodes and the mass lesion outside the airway, that is the transbronchial in the mediastinum. It can reach up to the distal hilar lymph nodes which are not even accessible with mediastinoscopy. Once a lymph node is identified, then the transbronchial needle aspiration, that is the TBNA, samples can be taken from the lymph nodes under ultrasound guidance, that is in real time. Generally, it is a day care procedure and the patient can be discharged on the same day after a few hours of observation. Sometimes post-procedure, patient might have slight cough and a fever that can subsided with the antipyretic. What is the diagnostic yield of EBUS bronchoscopy? We try to take samples multiple times from the various lymph node at a given time. This increases the yield of the diagnosis much better than the conventional bronchoscopy. In the majority of the cases, it can avoid the need of video mediastinoscopy, which is a surgical procedure. It is a very safe procedure where sampling is done in the real time so we can avoid hitting the blood vessel accidentally along with the lymph node or the mass lesion. I'm sure that this piece of information will be very much helpful to you all to understand the need for the EBUS bronchoscopy in various respiratory diseases. Nowadays, in the era of precision medicine, tissue is the issue, and the EBUS bronchoscope solve this issue up to a large extent.